Hello everyone. Today we will discuss about the anterior triangle of neck, and in that particularly about the carotid triangle and the muscular triangle. Now first of all, the carotid triangle. Over here as you can see, this is the carotid triangle. And this carotid triangle is actually present on both the sides of this anterior triangle of neck. Now the boundaries of the carotid triangle, these are mainly three: antero-superior, antero-inferior and the posterior. Now the antero-superior is actually formed by, as you can see, by the posterior belly of digastric muscle and the stylohyoid muscle, which actually embraces the posterior belly of digastric muscle over here. And the antero-inferior is actually formed by the superior belly of omohyoid. This is the superior belly of omohyoid, the infrahyoid muscle. Then the posterior actually formed by the anterior border of this sternocleidomastoid muscle. Now the roof of this is actually formed by mainly three structures, that is the skin, superficial fascia. In that we are having mainly the platysma muscle. In the superficial fascia we will be having the neck muscle known as the platysma muscle, the cervical branch of facial nerve and the transverse or the anterior cutaneous nerve of neck. And third is the investing layer of deep fascia. So roof actually formed by three main structures: skin, superficial fascia and deep fascia. And in superficial fascia we are actually having the platysma muscle, cervical branch of facial nerve and the transverse cutaneous nerve of neck. Now the floor is mainly formed by, remember, two constrictor muscle of pharynx, that is the middle and the inferior constrictor muscle of the pharynx, and also thyrohyoid membrane. Thyrohyoid membrane actually present on the superior part of the thyrohyoid muscle. Now the contents of the carotid triangle, these are mainly four: the artery, veins, nerve and lymph node. So just look at this diagram. In this, as you can see, first of all we have this artery known as the common carotid artery, along with the carotid sinus and the carotid body. Now you may know what is carotid sinus and carotid body. Carotid sinus is mainly present at the beginning of the internal carotid artery. This is the internal carotid artery. So at the beginning of this we will be having a swollen type body known as the carotid sinus, which actually acts as a baroreceptor. While over here, somewhere at the termination of this common carotid artery and the beginning of this two, external and the internal carotid artery, the bifurcation of this, we will be having one body known as the carotid body, which will act as a chemoreceptor. Now also in the contents we will be having the branches of this common carotid artery, that is the internal carotid artery and the external carotid artery. Now in the veins we will be having the internal jugular vein. This is the internal jugular vein. And also we will be having further three veins known as the common facial vein, pharyngeal vein and the lingual vein. Now remember, the common facial vein, if you know that this common facial vein actually formed by when the anterior branch or the anterior retromandibular vein actually unites with the facial vein, this common facial vein is formed, and this common facial vein actually drains particularly in the internal jugular vein. This pharyngeal vein also drains in the internal jugular vein, and this lingual vein actually terminates in the internal jugular vein. Now the nerves. In the nerves we are having first of all the vagus nerve. Over here as you can, this is the vagus nerve. Then the superior laryngeal branch of vagus nerve. And remember, superior laryngeal branch of vagus nerve actually divides into external and the internal laryngeal nerve. Then the spinal accessory nerve. Spinal accessory nerve is the cranial number 11th nerve. And the hypoglossal nerve. This is the hypoglossal nerve. And the sympathetic chain. Also in the contents we have carotid sheath. Carotid sheath is actually one of the deep cervical fascia of neck. Now the muscular triangle. As you can see over here, this is the green color structure is the muscular triangle. And remember, except the submental triangle, all triangles in the neck, in the anterior region of neck, are mainly in pairs, except this submental triangle. So of course muscular triangle actually present two in number on each side of the median plane of the neck. Now the boundaries. It has mainly three boundaries, that is the anterior, postero-superior and the postero-inferior. Now this anterior boundary is actually formed by the anterior median line of neck. Remember, anterior median line of neck will actually extend from the hyoid bone to the sternum. Now the postero-superior. Now as you can see, this is actually formed by the superior belly of omohyoid. Remember, superior belly of omohyoid is one of the infrahyoid muscle of the neck. Then the postero-inferior, this is actually formed by the sternocleidomastoid muscle. Now the content of the muscular triangle. As you can see, this is the anterior triangle of neck extending from here, and over here somewhat we will be having the muscular triangle. Okay, now as the name says muscular triangle, so of course it will be having the main contents as the muscle, and the main content is the muscle. So as because of this, their name is the muscular triangle. And we are having mainly infrahyoid muscle as a content in this, and we have mainly 4 infrahyoid muscle, that is the omohyoid, sternohyoid, thyrohyoid, and the sternothyroid. Means these 4 are mainly the infrahyoid muscle. Now as you can see, first of all, this is the sternohyoid muscle, and it actually extends from the hyoid bone to the sternum. And when we remove this sternohyoid muscle, when we dissect this out, we'll be able to see 2 further infrahyoid muscle, that is the sternothyroid and thyrohyoid. And this is the omohyoid, superior belly of omohyoid and the inferior belly of omohyoid. Now this infrahyoid muscle have the following general features, that is, first of all, they are mainly arranged in superficial and the deep layers. Now which 2 muscles are actually superficial? That is, remember, superficial are the sternohyoid and the omohyoid. These 2 muscles are the superficial muscles, and when we remove this muscle, we will be able to see the 2 deep muscle, that is the thyroid and the sternothyroid. So they are arranged in 2 layers. Now next feature is they are mainly supplied by the ventral rami of cervical number 1 to cervical number 3 spinal nerves. These all supplied by the same nerves, that is the C1 to C3 ventral rami. Now they are actually attached to the hyoid bone and the thyroid cartilage, and as because of this, because they are attached to these 2 structures, they move these structures. Now sternohyoid, sternothyroid, and the superficial belly of the omohyoid, these 3 muscles are actually present at the superficial convex part of the thyroid gland. These 2 structures are actually present. Now the isthmus of this thyroid gland, as you can see, this is the isthmus of the thyroid gland. So the isthmus of this gland is actually covered by the right and left sternohyoid muscle and the sternothyroid muscle. So mainly these 5 features, superficial and the deep layer muscle, supplied by ventral primary rami of C1 to C3. They are actually attached to the hyoid bone and thyroid cartilage, and as because of this, they can move these structures. And remember, superficial belly of omohyoid, sternohyoid and sternothyroid, these 3 muscles are actually attached or connected or covers the superficial convex surface of the thyroid gland, and the anterior surface of this isthmus of this thyroid gland actually covered by the sternohyoid and the sternothyroid muscle at both the sides. So this was all about the carotid triangle and the muscular triangle. To know about the submental triangle and the digastric triangle, just refer my previous video about the anterior triangle of neck. So hope you know it well. Thank you so much.